very significant cancer research we're doing right now. I'm at the Argonne National Labs, so we use synchrotron radiation. My team, we did all the work with remineralization, demineralization with many products such as MI-Paste using synchrotron radiation to do nano CTs. We did all the work with the abfraction and utilizing real-time synchrotron radiation nano CTs to study abfraction occurring, which is a very fascinating thing.
Yeah, I bet.
So I do a lot of very high-tech research with nuclear magnetic resonance at the MMR. We did all the cryobio research on SARS-CoV-2. You might remember that. We're
Mhm.
working on trying to block entrance using Vera 76 cells, immortalized cell lines, and working on utilizing nasal sprays, which has come back substantially because of all the research coming out of many countries, including countries like Panama. There's Dr. Eves. Hey, how
Hi,
are you?
Doctor.
Well, there's a
Awesome.
smiley face. Yeah.
Well,
And I guess it's time
yeah,
for us to get started.
it is. It is 12:31 and it is Thursday. So I am grateful for everybody that has joined the hub today and definitely grateful for our guest, Dr. Cannon. So he is a NADG supported pediatric dentist and he is an expert in oral and systemic link and everything in between. And I think if we shared his credentials, it would probably take our whole half an hour just to get through that. So I do know that I think he will blow your mind today. So, I would get some paper and pen ready. And this might be an episode that you're going to want to revisit. So we will record it and share it with you guys next week. But Dr. Cannon has a lot to share. So if you have questions, please don't hesitate to put them in the chat and we will get the opportunity to ask him those questions at the end. So I think, Dr. Cannon, you're going to talk to us about how to save lives today, right?
Absolutely, because, we may not know it or we didn't know it, but the last few years, especially the last 3 years, there's been so much published on the importance of oral health. I'll put it in perspective. The most important person for healthcare right now are you guys, especially hygienists. You have a job that is so important in education that it is extraordinary. No one really realized it until very recently. I mean, there was hints, or we've known for a long time the oral systemic link, right? We've known about that. Actually, they've known about that for 3,000 years. Unbelievably, the the Roman historians would write about Tacitus about how they at the slave auctions always look at the teeth at everyone coming in, all the captured German barbarians. So 3 years ago, published in JAMA Pediatrics, was an article where they had followed a number of young people who had had many oral problems. The kids with all the early childhood caries and all the other issues. And they found after 27 years that they were the adults who were the first to develop all the subclinical signs of atherosclerosis and cardiovascular disease. It'd be lovely if we just had that, but no, there's so many more articles on it that are amazing because we now know that early on, the earlier the better that we start good oral hygiene, the better for the health of the patient. You see, the oral cavity has the oral microbiome, which is now classified as a gateway microbiome. What is a gateway microbiome? Well, there's three gateway microbiomes: oral, placental, which is a very important gateway microbiome, and possibly the nasal microbiome, which until recently had never ever been deep sequenced. So no one actually knew that much about the nasal microbiome. We're just right now at Northwestern, my study on nasal microbiomes. We're just now finishing the deep sequencing to look at all the strains. There's 39 trillion microbes in and on the human body. These microbes control everything. They control behavior. They control how you manage your micronutrients. They actually control your entire immune system. They control whether or not you respond or not to chemotherapy. There's incredible research coming out of Europe with cancer and chemotherapy showing that the microbiome actually, there's a specific microbiome for colorectal cancer, for oral cancer, for esophageal cancer, a specific microbiome for breast cancer. And it's these microbes that control not only whether or not you get these, because there are specific ones, but also if you respond to chemotherapy. What controls it is the oral microbiome. Again, shockingly, just 3 years ago, dermatologists made an amazing discovery. They discovered that the skin is attached to the human body. Now, I'm being facetious, of course, but to them, they actually admit that they finally found out about 3 or 4 years ago that you could diagnose a child, a teenager, with acne without even seeing them by looking at their stool sample. There's a specific microbiome associated with acne, a specific microbiome associated with psoriasis. We now know from the long-term studies what actually causes psoriasis, and sure enough, it's strep pyogenes infections as a child. Everything goes back to childhood. Even recently, cataracts, if you can believe this, and glaucoma. There's an intraocular microbiome. There are specific bacteria that grow inside your eye, and they can invade inside the lens, giving you cloudy lenses and creating cataracts. Can you believe 2 to 3 million people get cataract surgery a year in the United States? It's actually due to bacteria. So these are all shocking new discoveries. But every time, whether it's the ophthalmologist or the dermatologist, are looking back at how do these bacteria, how do they cause this to happen? It's the gateway microbiome, the oral microbiome, acknowledged so about 4 or 5 years ago by the Nobel Assembly in Stockholm. I was there at the time, and I was the person who was really pushing the acknowledgement of the oral microbiome as the gateway microbiome. This is where the mouth, where all the pathogens get in, and you have to have the good guys to prevent them. Classic example. What do kids with early childhood caries have? What are they missing? What they're missing are the nitrate reducing bacteria. Every child who gets decay, they're missing a group of beneficial commensals. Beautiful research going back to 2004, published in Europe. Why do kids get cavities? They're missing the nitrate reducing bacteria. Guess what will happen if you're missing your nitrate reducing bacteria? You later on get periodontal disease because you need the nitrate reducing bacteria that break down the nitrates in the food you eat. When you eat something green, like that arugula, and I see Sarah was eating that salad. I'm just kidding, Sarah. I don't know if you had a salad or not. Just having fun there. Maybe it was Bethany. Who knows? Someone had a salad, and then as they were eating that salad, their nitrate reducing bacteria were breaking it down to nitrites. You swallow it, and your stomach turns into nitric oxide. And then your body sucks back the nitric oxide and concentrates it by a value of 10 times higher, throws it back in your saliva so it can kill the pathogens. Oh my God. It's so simple and so beautiful, but nitric oxide is totally necessary for your capillaries to expand. That's why if you have a cardiac event, what do you have in your emergency kit there, Adrian? What do you have, Abigail? You have your nitroglycerin, and the nitroglycerin goes under the tongue and becomes nitric oxide. It causes capillary dilation. Blood can flow to your heart, to your lungs. So when you work out, let's say Lisa likes to work out, or Constance does, and they get on there where they're working out. As you work out, you're breathing through your nose, and the paranasal sinus produces nitric oxide, which goes down into your lung. It causes your lungs to expand so you can breathe easier. Also causes dilation of your blood vessels, the capillaries. Essential for that. If you take a oral mouth rinse like Listerine, there's Adrian. If you take your Listerine and rinse with it before you work out, guess what happens? You lose the value of your workout. I can show you all the published peer-reviewed journals on this. There's a ton of research on how antimicrobials lead to cardiovascular disease. Published in cardiology journals like Current Hypertension Reports that you have to keep your oral nitrate reducing bacteria. So we have to be very careful in how we treat our patients. You guys are number one. You are the most important people in healthcare today. You should be recognized as such. But we need to go patient centric. To go patient centric, we have to look at the microbiome as a whole, the 39 trillion microbes. 99% are beneficial. We need them. Look at germ-free animals raised in the lab. They have tons of issues, many issues, including, like they're doing in Europe now, they're doing fecal matter transplants for patients with psychological issues, with OCD, with anorexia nervosa. They're giving them fecal matter transplants. So they use universal donors for very healthy feces and very healthy microbiomes and reversing a lot of issues with OCD and OBD and anxiety depression. Anxiety depression is huge being treated now without medication because of converting the microbiome back to being normal. Kids with autism don't have a normal microbiome. You might see all my research I've done on that. We've done some phenomenal studies doing the full metatranscriptomics, going all the way down deep, deep diving into the microbiome, showing all the functional groups, all the functioning RNA, and how the body responds. And we know exactly what pushes everyone toward autism. We got it. I presented at the Society for Neuroscience last year. So what we have to do is start very early on, especially with women who might have a child in the near future. They must have a normal microbiome. Dr. Kirsty Argard is just now publishing their famous research from Baylor, done over a 10-year period at multi institutions, working on Malawi. 12,000 women, they randomly were assigned to a xylitol chewing gum or a non-xylitol chewing gum. I'm sure you've heard about all this in the news because the women who were on the xylitol chewing gum not only had a far less level of periodontal disease, because they check for periodontal disease too. Everyone knows that xylitol treats periodontal disease, but the preterm birth weight dropped a lot, the miscarriage rate dropped, and very significantly, the babies could feed much better. Because when you affect the mother's microbiome, you affect the breast milk too, very significantly. Human breast milk is very unique, between 30 and 130 different oligosaccharides, and it depends upon the microbiome of the mother and the diet, but the microbiome that what stimulates the production, because see what tells the mammary glands what to produce for milk to lactate is actually what microbiome is there, because you produce the oligosaccharides, the fats in the breast milk actually for the baby as to what bacteria the mom's giving. Breast milk is full of bacteria. It's loaded with all sorts of probiotic bacteria. So always treat the mom. When you treat the mom, the babies will be healthy and they grow up to be healthy kids. Now we can go back to another famous xylitol study on that. The one with the chewing gums from 3 months of age to 2 years of age. You guys might remember all this. They had three different groups. One group's a mom that had fluoride varnish given, another group that had chlorhexidine varnish done, a third group that had xylitol chewing gum. And they looked at the three groups and they followed them for a period of time. The ones with the xylitol chewing gum uh, gave far fewer pathogens to their kids. The mutant streptococci level was very significantly reduced. I think it was by 73% reduction in the level of mutant streptococci passed on to the kids. But when they checked them for cavities later at the 5-year and 10-year spot, the cavity rate was dropped by 71% at 10 years by chewing gum during the 3 month to 2 year period of time of life of the child. So, what I really want us to do is be very fully aware of the benefits of the prebiotics and the probiotics. Prebiotics encourage the growth of the good bacteria. Classic prebiotics, the most commonly used ones now, of course, are foods. And, from various foods like asparagus and Jerusalem artichoke, you get all the fructooligosaccharides that are good for your microbiome. All the tubers, all the things from the ground, anything that you dig up, those are very high in prebiotics. Also, the galactoligosaccharides, which come from milk products, those too can be very beneficial for the microbiome. Uh, and the classic are the polyols. Now you can't see me, but I have right here in my hands a big jar of spry mints, and there's 1,000 in here. You can see that, Kelly? There's a jar of 1,000 mints right here. And the xylitol, humans are completely different. I mean, in many ways, right? But Homo sapiens is very unique. Homo sapiens is a lot different than Neanderthalensis or Rhodesiensis or all of our fellow hominins that we evolved with. That at one time, you remember there was 5 different groups of humans on the planet. I mean, people forget this, but there was 5 different hominins at one time living. The Homo sapiens developed in sub-Sahara Africa and ate a lot of tubers. And tubers are loaded with xylose, D-xylose, and xylitol and mannitol. So much did we eat to survive of tubers by digging them up out of the ground that our mitochondria use xylitol for energy source. So humans, rats, mice, and gerbils use xylitol as an energy source. And the rats are because they moved in to caves with humans back 250,000 years ago or better, Homo sapiens. And mice, 12,000, 14,000 years ago, as became farmers, they moved into our granaries. And so they kept picking up food that we would eat, and they converted their mitochondria, which are actually they're just really bacteria within your cells, which brings up why it is so hard to treat periodontal disease. Why is long-term success so difficult with so many of these pathogens? How do they actually work? We have a keystone pathogen, Porphyromonas gingivalis, PG. You guys all know PG. There are 6 strains of PG in Homo sapiens. There actually should only be 3, but the other 3 are actually zoonotics. They came to us from dogs about 30,000 years ago. That's why ancient Egyptians had severe periodontal disease too. It's been with us for thousands of years, periodontal disease. Porphyromonas gingivalis attaches to cells using an attachment called the Fimbria attachment. Goes down through the beta integrin receptor. It goes intracellular. It goes inside the cell. So whenever you're cleaning someone's teeth, you can't get inside the cells to get them out. Porphyromonas gingivalis goes inside the cells and forms these vacuoles or vesicles, phagolysosomes, and in that it lives and propagates. So PG is like a parasite. Best way of looking at it. It's inside your gingival epithelial cells living and propagating, increasing in size. And you can see them when you look at with really good transmission electron microscopy and confocal. You can actually look at PG inside all your cells. It goes into your endothelial cells. It goes inside your macrophages. So your own tissue defense cells are turned off. It no longer phagocytizes or eats the PG, but instead releases high levels of local nitric oxide. PG is protected from it, releases it to cause more capillary growth into the periodontium so the gingiva can swell with blood. So when you're scaling and looking at your patient, you see the gingiva that's swollen, there's increase in histamine being coated, there's an increase in nitric oxide, but not killing the pathogen. Because meanwhile, Porphyromonas gingivalis is gone inside the cell. Once it's inside the cell, it goes, the vesicles go near your mitochondria and they cause the mitochondria to leak ATP, which is called the danger signal for a cell. When that happens, the cells go into what's called senescence. And you've heard about senescence, that's like aging. So apoptosis, the dying of the cell, is turned off. The cells start to pile up and swell. You go, whoa, wait a second. So I'm looking at puffy gingiva. I'm looking at gingiva cells that were supposed to be dead that aren't dead, and they're piling up on each other. When I lecture to dermatologists, they always go, ha ha, like psoriasis, like the keratinocytes pile up. You get the scaly patches of the keratinocytes. They're not dying like they're supposed to. I go, right. You're not replacing those gingival cells with new cells. You're piling them up. What's the best description of that? Adrian, what's the best description? A benign tumor. That's what benign tumors do. A piling up of cells that won't die. What's the best treatment for that? A laser. Because when you take a mechanical instrument like a scalpel, you cut through those cells to remove it. You cut through the cells, you injure them, and they release the PG from the vesicles, and they go back alive because they've been too hibernating. They go into the sense of we have a safe place to live. We don't want this cell to die. They actually don't want the cell to die. They want it to keep going because they're living inside that gingival epithelial cell. They're living inside the endothelial cell, and they break your blood-brain barrier, and that's why you find Porphyromonas gingivalis in the brain with dementia. That's why you find it growing and giving off its byproducts in the gingiva and the endothelial cells. So everyone now, you can read the Alzheimer's journals. Everyone now in the journal of Alzheimer's disease and all that, they're talking about the gingipains coming from Porphyromonas gingivalis and the leaky blood-brain barrier. And everyone now realizes that Porphyromonas gingivalis causes a systemic illness with symptoms of eventual dementia, cardiovascular disease, and periodontal disease. When I lecture to periodontists, they sometimes don't like that because they're no longer do they have a disease anymore, so they really don't have a specialty. No, I'm sorry, I'm having fun with that. That's just for fun. And so uh, I like teasing people as a group. So now we know that if we're going to stop it, we have to stop it with something that goes inside the cell. That's why antibiotics work because they go inside the cell. But they're a dual-edged sword because then you also affect the gut microbiome, right? And certain antibiotics have been linked to a number of cancers. Certain other antibiotics have been now are starting to be used for cancer, like the tetracyclines actually inhibit cancer cell and inhibit colorectal cancer, whereas some of the others actually cause colorectal cancer. As you know, that huge study that came out of Europe recently with 1.7 million kids, the number one initiator for celiac disease in children is the history of antibiotics the first year of life because it messes up their microbiome and you kill the gluten metabolizers and then all the gluten just causes all this massive immune response. It's absolutely crazy. So everything has a dual-edged sword. So going back to that, Porphyromonas gingivalis is now recognized as a top thing. So like in August, I'm lecturing at the Integrative Dermatology Symposium, and the dermatologists are having me on podcasts all the time because they go, "Oh my God, actually, the problem dentists need to get that darn oral microbiome under control so we can get the skin under control." You hear it now from everyone in neurology. Yeah, here, I know we're almost at the end, but I'll leave you some very important things to remember. Porphyromonas gingivalis is an extremophile. It's a zoonotic disease that has learned to infiltrate our immune system. It's a gorilla. You carry it all your life. A lot of people have periodontal disease from age 16, 17 years of age. The great British studies have been published in British Dental Journal. The average onset periodontal disease in the UK is age 17. When you actually say that patient actually started periodontal disease. By age 18, 19, 20, you already have atherosclerosis starting from it. We know that from brilliant studies that were done, sadly, on our war dead from the Korean War. We're talking about the 1950 now. 1950s, they were doing studies on this. Korean War dead and Vietnam War dead from the 1960s, they were kept looking and doing cardiac autopsies showing that about 50% of them already had atherosclerosis. And they're going, where's this coming from? They didn't know about PG breaking down the tight junctions between your cells. They didn't know that PG, porphyromonas gingivalis, can release the tight junctions, letting everything leak. They didn't realize it was a zoonotic disease. They didn't realize it jumped to us from another species. We shared it with another species and gave it back to them in spades. And that is why dogs have such severe periodontal disease. Now cats are suffering terribly from periodontal disease. So the best things we have really, and we should augment all of our patients with, are the probiotics and the prebiotics. So with NADG, and I've been working with Dr. Mata, we're looking at launching a good number of really very well proven probiotics and well proven prebiotics that, like the xylitol stuff, has hundreds of references on, hundreds of published references. Uh, you have the same thing like with BioGaia Prodentis. They have over 120 published clinical trials. In fact, they have so many published clinical trials, they could actually apply to the FDA, have it classified as a drug successfully. But they don't want to do that. We don't want it a prescription product. We want it readily available to everyone. So our game plan over the next, year or so, whatever, is to start having a pilot program and start having a lot of the dental hygienists be well trained so you can discuss all this with your patients. I'm offered to put together I have a bunch of PowerPoints I've given already. I'll give you guys some PowerPoints on. We want to start getting the prebiotics, the probiotics. I mean, we got Probiora Pro, which has been around, research on that since the late 70s. I mean, Jeff Hillman and Sakransky, Edmund Sakransky, all those guys, Bruce Pastor did the research on that in the late 70s, early 80s, showing the efficacy at Harvard. But it's time for us as a profession to start augmenting our patients with these safe, effective things. And let's get that oral microbiome under control. Let's take back that oral gateway. Let's control the oral gateway so that, yeah, we save lives every day. That's topic. Let's go to work every day knowing that we're going to end up saving some lives. I mean, if you've ever worked in a nursing home, you know the opposite of what we want. Go to a nursing home and they're all in horrible shape. I mean, you go around and I have volunteered time at the facilities and I just go, I'm shocked and horrified at how bad a condition. And one of our new hygienists said she just worked in a nursing home and she goes, most of the time they refuse to be helped, but they suffer from dementia. Let's don't let this happen. We know why it happens, we know how it happens, and we know what we can do. So yeah, as Kelly knows, I'm passionate about it.
I mean, you have a purpose, right? You have a purpose outside of, being that tooth mechanic. It really is, that total body health approach. And, the thing that I just really wanted to ask you before we wrap it up is obviously we have, a large task at hand and we have a lot of power in the hygiene chair. And I think probably one of the biggest struggles as hygienists is figuring out how to communicate something that is probably complex to our patients. How does your team communicate this with the patients to get them to see the importance and understanding it?
I'm so glad you asked that because hygienists have the position to do it. They're
Mhm.
sitting there, you have your scaler and your mirror in their mouth. They can't talk. You can. You have them right where you need them.
Yeah.
You have them. You have the time. What should be done, and we'll go over, I have some scripting I've actually done in the
Mhm.
past. We'll go over some scripting where you can say, by the way, did you hear about this?
Mhm.
And a lot of times I say, yeah, I did hear something. Sadly, a paper just came out in the Academy of General Dentistry. that the number of Americans aware of the oral and systemic health link has dropped from 36% to 30%. How people lost knowledge, I don't know. So one out of three people know something about it already.
Mhm.
Our job is to make it 99%. And you know what? Every 6 months, when you tell them a little bit more, a little bit more, a little bit more, and you give them stuff, like I often will give them little brochures and pamphlets from various companies. I say, "Oh, here's this from Probiotic Pro. It tells you all about the good bacteria and the bad bacteria." They take it home. I would say I probably have maybe 1 out of 5 of my patients on probiotics right now. I don't give them to everybody. I just, they have a history of caries or they're developing a lot of plaque. I go about the stuff. If they are pretty pristine, I have a lot of patients who are pretty pristine. Uh, then I don't want to, destroy the effectiveness of it later by overdoing something.
Yeah.
But yeah, you guys,
Awesome.
you guys are awesome. I tell you, hygienists, what you have going for you guys right now is just amazing. I mean,
Yeah.
it's just so totally amazing. And it's really great when you sit down and the patient says, "Wow, so I guess I really have to worry about this in my heart." Oh, absolutely, because that's what the research shows. Remember, I'll show you the articles later. When they go through and they look at all those atheromas, every one of them, every one of them will have bacteria in them. Every one will have bacteria, and they're oral bacteria, and it's from the leaking of the great research done by Signe Feingold and the other guys out of UCLA, showing not only in the uh, cardiac arteries but also in the brain, and showing all the markers and everything. And of course, if you find those in the bloodstream, what do you have? Those are biomarkers for diabetes, hypertension, and obesity. Oh, last thing, definitively, if you want to read some really crazy good stuff, look at the germ-free mice studies where they've taken Porphyromonas gingivalis, squirted it in their mouth, walked away, and did it again a week later. And they see the gut microbiome change in the mice, and they see a seeding that goes on. I'm sorry, I said germ-free, but they weren't germ-free. You see a seeding that's going on, and then they get the biomarkers. But the best one was just published. So 3 times a week for 4 weeks, they squirted Porphyromonas gingivalis in the mice mouth, and they kept testing them. And of course, they did their fecal matter. They looked for all the metabolites and all the markers. They also looked for inflammatory markers in the blood. They showed all of them went up significantly. And cognitive decline. The mice had a much harder time completing their tasks. And I'll show you guys that article. You read that, and you go like, "Oh my dear God, how are we allowing this to happen? Let's get PG under control." Hey, thank you so much for your time, guys.
Yeah, and we'll have to do a Dr. Cannon 2.0, but we'll share this in the Hygiene Connected. And if you wanted to send me any PowerPoints that you had or the verbiage that you had, we can put that in the newsletter with the recording for the whole team to be able to view later on. So it was really great, and I really appreciate it.
Hey, no problem. Thank you guys so much for taking your lunchtime to spend a little time listening to me ramble about my passion.
It is your passion. You're on a mission, and we're going to get on the mission with you.
Okay, thank you again so much. Okay,
Awesome.
bye
Thanks,
guys.
buddy. Bye bye.
Bye.
Thank you.